welcome back to Medical Coding with Blue. Today's episode is all about new medical coders. Apply to the job anyway. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay guys, so disclaimer first. If you get extra sensitive when people are direct with you, please do not watch this video because I am going to be very direct. We don't have time to waste. There's a lot of people out there that are brand new medical coders talking about how disillusioned they are because they can't find a job in medical coding. Everybody wants experience. Newsflash, they're always going to want experience. They're always going to say, we want somebody with 3 to 5 years experience because no one wants to train, unfortunately, okay? Not all people, but the vast majority of them do not want to train. So what you need to do is to apply anyway. Because if a employer is looking for new medical coders, or medical coders rather, and they're saying that we want people who have experience, and all the experienced coders in that area are already working, they are not going to move. So if you show up and you apply, guess who's going to get the job? You. Especially if you have a very good, well put together resume and you can pass the assessment test. There is no point in running around talking about how, oh, everybody wants experience, everybody wants experience. They're going to want experience because, like I said, they don't want to have to train. But if we ignore that and we know that we have the training, we have the skill as new medical coders to do the work, then we should apply. Because number one, it's free to apply. Okay, number one is free to apply. Number two, as my Uncle Kyle says, a closed mouth does not get fed. They do not know that you exist. They do not know that you are a brand new medical coder out there trying to find your first job. And they do not respond well to, well, I'm looking for an entry-level job. No, you're not looking for an entry-level job. You're looking for a medical coding job. And if medical coding is what you want to do, you don't have to apply for a medical biller. Medical billing is if you want to do that or you're okay with starting in an alternative job like medical billing. Maybe you went through a fast-paced medical coding program and you say, well, Blue, I'm not quite ready to be a medical coder just yet. Maybe I could do some claims processing, you know, as a biller. That's totally fine. You can totally do that. And so that way you can kind of build up your skill and build up your knowledge base and get some of that experience, because even though you are doing the billing, if you decide to go the billing route, you're still having exposure to codes. You're still seeing the denials when they're coming in. So you're learning more about the coding. You're seeing the codes that are being submitted, and you're seeing what gets approved, what doesn't get approved. And you're recognizing those things, the denials and things like that. So that's fantastic transferable skill for you to build. But you will never build that if you are running around saying, entry level, entry level. There was a lady that friended me on LinkedIn, and she's talking about how she was so sad because she missed the first round of entry-level coders at this one place wherever they were hiring. And then she was saying, well, does anybody have any entry-level jobs? Why can't you apply for a coding job? You are a coder. That means that you have been tested on all of the subjects, all of the domains that are covered on these exams. She has a CPC, for example, and she's been tested on every single one of those. So she's shown competency in getting those because she got her certification. So that's you too, okay? If you are out there, stop looking for entry-level jobs, okay? And even if you are still continuing to look for entry-level jobs, guess what? There's thousands of other people that are looking for jobs too, because they don't listen to sound advice. They don't listen when I say, don't worry if it says entry-level or not. Because even coders with experience, when they're coming into a new facility, they still have to get trained on the electronic health record if they don't have experience with it, just like you do. Just like you will. That is the one thing that employers are willing to train on, is the electronic health record. If you have experience with it, it's a bonus. But if you don't have it, it's okay. Because they recognize that every facility has a different version of the electronic health record. So even though somebody uses Epic at one facility, it may not be the same, or something may not look the same at another facility that uses Epic because they have a different package. So that's something that you have to kind of look at. So that's the thing I want to say today is this. Stop feeling sorry for yourself, because some of you are posting things, and I know it's because you're feeling sorry for yourself. This one lady was like, because I had posted, even if you don't have all the qualifications, you still need to apply, because that's how these employers are going to know that you're out there looking for a job. She comes on there on my page and starts complaining, oh, I've been looking since 2016 and this is a scam. So if you've been looking since 2016 and we're in 2025 and you claim that this is a scam, shouldn't you have done your research and found a job as far as like, okay, well, if I'm not finding a job on my own way, what else can I do to improve my odds? Okay, let me make sure that I check out these free resources on YouTube about medical coding resume tips. I give those freely on my channel, okay? I am a resume writer myself, and I write resumes for not just medical coders, but a lot of other professions as well. And never a guarantee, but I have been successful, because a lot of times, even with new people, you are coming to me and if you have a multiple page resume, that's already the reason that you're getting rejected, is because you have a multiple page resume. So you need to cut it down to one page, and I've said that several times, and that you need to make your skills clear. Okay, I don't care that you're organized, that you're a team player. That should never ever be on your skills list, because if I see that, that's a person I'm not going to hire. If on your resume you don't identify your credentials next to your name, again, another one I'm not going to hire, because you're not telling me up front what you have. There's a difference in these credentials, and I've done videos several times talking about what the differences are. I don't want to repeat again, but there are some credentials that cover certain things and other credentials that cover both things. So that's the thing that you have to understand. And these employers have very little time to be messing with people who want to have their hand held. Okay, that lady that's been going on since 2016, she's somebody that wants her hand held. And you know how I know? Because when I looked at her page, at her contact picture was not professional at all. Her presentation of anything that she's been posting is also not professional at all. So again, that's something else that you have to kind of keep up and watch. Because if you're acting like this on social media and you're applying for jobs, don't think that those people are not looking at your social media. And don't think that they're not going to judge you based on what you have on social media as well. So that's something that you all have to understand, that when you're posting things on social media, you need to be right when you're out there. You know, you need to show that you're professional, not all crazy ways and things like that. You know, or have these filters, you know, because they do the little reindeer ears, and I've seen those, and they're like crying that they can't find a job. I wonder why. You don't even have a clear picture of your face on your contact picture. These are things that are little details, but they matter. And that's the difference between somebody that's going to get a job and not get a job. And also the number of applications that you put out. Well, Blue, I put out 100. Well, you know what? Sometimes people, it takes them 225, 300, 350 before they find their first job. And again, are we being intentional when we are applying? And what I mean when I say that is that you're updating your resume to the job that you are applying every single time that you're applying. So if you're applying for a HIM Coder 1, you're changing on your professional objective, because you got to have that. You do not have a summary, you have an objective as a brand new coder. What is your objective? That's when you identify what position you're applying for, because that's when the ATS reader is looking for in your job listing too. I mean, in your resume. Is it having things that match the job listing? Okay, so you got to update every single time that you're applying. And don't complain to me about how you don't want to have to do that. Do you want a job or not? You're going to do this because you want a job. Okay, and another lady was like, and I had told the lady to apply and apply. Well, am I qualified? Yes. According to her credential, yes, you are. You can apply for inpatient coding or outpatient coding. Still, oh, well, my only experience has been in school. What did I say? To apply even though you have no experience. You have a credential. You are not going to get experience if you do not apply. You will not get experience if you do not apply. Somebody will take a chance on you, but it's going to take you to, apply to these things correctly. Have a one-page resume. Do not go back more than 10 or 15 years in your job history. Your jobs that you've had before, you think that they do not, and I'm using quotes, okay? I will use quotes as much as I want to. If you think that none of your past jobs will transfer over because they're not related, think about this. There's lots of transferable skill. You're probably just not seeing it. And I've talked about the person who works at the Dollar General. Well, they have to be able to multitask. What are coders doing? Multitasking. And not only that, they have to some of them keep track of the inventory at the Dollar General, right? So you have to know numbers and letters. That's the thing that we have to know. We can't be getting numbers and letters mixed up because then we have invalid codes or we have incorrect codes. So we need to highlight those types of skills when we're putting those on our resume. Watch my videos about resume tips. It is free, guys. It is free. And for somebody that writes resumes, for me to give you this information for free, I don't know why more of you don't jump on it. But the ones that have taken advantage and said, Blue, I used your resume tips. I updated my resume and I listened to your interview tips as well. And they've been able to go on and get a job. Fantastic. Fantastic. But again, guys, it's not going to come easy. And if you are looking at all of these things and it's got to have entry level, you're going to be looking for a long time. You're going to be like that lady from 2016 who still can't get a job, who insists that this is a scam. Then why would you continue to look if it was such a scam? Really? Yes, I am annoyed at that one comment because of the simple fact that it's people like that run around and talk about, oh, I can't find a job, so it must be a scam. So you mean that you didn't do anything to perpetuate that? As far as like the reason that you can't get a job, you're not putting in any effort to your profile picture because it's just all kind of crazy ways. What you post on social media is terrible and your attitude stinks. So what do you think that those employers are seeing? So stop making it where you have to see entry level. You need to apply even though they're asking for experience. If you have the credential that they're looking for, you need to apply for that. Okay? Apply for it. And then when you are out there and you're applying and they give you an interview and you go to the interview, you're going to do your best. You're going to show up in your Sunday best. We call it Sunday best here in Texas, but a nice outfit, nice clothes. And you're not going in there reeking of cologne or perfume, okay? Don't ever do that. If you have to go in person, you do not wear cologne or perfume because that's the person I'm not going to hire either because I shouldn't have to sit here and practically drown in whatever you sprayed on. I'm just saying. And with that said, if you have a virtual interview, you want to make sure that the room is quiet that you're in, that you are looking at the camera lens and not looking at yourself like I am right now, that you're actually looking at the camera lens. You need to make sure that your area is free of cats or dogs because it's not cute when you see a cat walking across or a dog barking incessantly. You need to be there. You need to be on time. You need to be focused. And if they say no, that this is you're not the candidate for them, that's okay. And if you end the interview and it went really great, you can send them a thank you email. It's customary to send it only one time. If you're starting to say, well, how many times should I follow up? No, you only do it one time and then you move on to the next one. You don't sit here and keep calling those people because then you're for sure not going to get hired. Okay? And stop looking for, oh, only remote. Because my new people, y'all are good for that too. Oh, I only want to work remote because of X, Y, Z. Let me tell you something. First of all, you shouldn't be working remotely your first job out of the gate. However, I understand East Coast to West Coast people. I know space comes at a premium. So a lot of people are going to be remote anyway. But that shouldn't be what you are looking for right out of the gate. When you are brand new, you need to be around other coders because you need that exposure to help you to learn. And for my people that got hired during the pandemic and they said, oh no, Blue, I've been working home ever since then and I don't have a problem. You don't know what you don't know. You don't know what you don't know. If you have never had exposure to other coders and you've always been at home, trust me, I don't want to sneeze. If you have never had any coder exposure, you've only been by yourself, that's where you're going to be missing out on things and you don't even know it. Okay. So with that said, stop looking for those remote positions. You need to be open to anything. If it is in person, if it is remote and you just happen to luck out, you happen to luck out. But don't let that be the focus of your job search, because if it is, that's you putting up a barrier as far as like the job that you can get. And so when you start putting up more and more barriers, oh, it has to say entry level. Oh, it has to say risk adjustment. Oh, it has to say remote, fully remote. Or, oh, it has to say part-time. You're putting up too many barriers for you getting in. You haven't earned the right to ask for those things right out of the gate. Just being very direct with you. Not rude, just very direct. You haven't earned it yet. When you get experience, absolutely. And I'm not even saying for you guys to be working in person forever, you know. If that's your first job out of the gate, I don't say to work forever. You can work just a few months around other coders. So that way you're not going to be lost in the sauce when you get out there and you start coding remotely on your own. Okay, remote used to be where you had to have experience in order to be able to do that. Excuse me. But again, you're never going to get that experience if you keep putting up these barriers. I don't care what they told you at the school. The school is just trying to sell you a product. The school is trying to sell you that dream so they can sell another seat in that program. That's what they're trying to do. Oh yeah, you can work at home. You can do all these things. Not telling you how hard you have to work. And that when you work remotely, your productivity is higher than if it is in person. Now, I've said it too. If you live in the rural area, I understand you're wanting to work remotely. I get that. That makes sense to me. But again, if you can absolutely help it in order to get your foot in the door, then you want to go to those in-person jobs. Because trust me, there's so many people that are looking for those remote jobs, that those in-person jobs, they're out there. They are out there. And coders are called different names. If you just keep looking at medical coder, well, again, you're just narrowing your field and not really realizing that coders are also called coder 1, coder 2, revenue cycle technician, medical records technician. We're called all kinds of names. So how do you figure out what we're called? You need to look at that website directly for that hospital you want to work for. Quit messing around with LinkedIn or all these other job websites, and actually go to the hospital place that you want to work at. Especially if you work in a hospital. You want to work in a hospital? Then you go to their website and you click on careers, and it'll bring up all the jobs that are open there. You don't have to be at the mercy of these platform job posting sites, because a lot of them, they have like a lot of like scam people there too as well. So don't worry about that. Go directly to that website for the place that you want to work, okay? And coders work everywhere. They work at hospitals, they work at urgent care centers, they work at nursing homes, dialysis centers, pathology, like the labs, right? Like Quest, right? So there's places out there. And then if you absolutely can't find something there is always the coding adjacent positions that will get you that experience. Again, if you're not quite ready, or if you just haven't found a job as a coder, you can go into these coding adjacent positions. There's claims processor. That's a person that's working for like the insurance company. Blue Cross Blue Shield and Aetna are the two that I recommend that you go to their website and check them out, okay? Do not ask me about a direct link, okay? Because I'm telling you now, all you need to do is just go to their website and go to careers, and you'll be able to see all of their jobs that are posted. They have jobs for claims processor. They may call it something else, claims reviewer, but not reviewer like approving a procedure, but claims reviewer like reviewing for like denials and things like that. So what they have you do in those types of positions, because you're working for the insurance company, you're getting the claims from the doctor's offices, the hospitals, you know, all these places. you're getting these claims, you're running the codes through the encoder. Encoder's going to tell you if there's any edits. Edits means there's something wrong, that there's something missing, or there should be a modifier, or these codes don't go together, or there's an age conflict or a gender conflict, something. And so that's what you're going to say, okay, well, this claim was denied because of XYZ, whatever the reason came up. Or if it was approved, then okay, then you hit the process for the claim to be paid. And so that's what you do there. But that's getting you exposure to those codes. And those positions do not require the individual to be certified in medical coding, because you're processing paperwork. So that's something that you can use to kind of help you get in. But again, if you are being so stubborn and, oh no, I want to work at home remotely and work in coding, and you don't listen to this kind of advice, I can't help you. I can't help you, and I hope you don't post on my social media either, because no one can help you then, because you just want to complain. And there's people that want to complain. I know it's frustrating, because I went through this too, not being able to find my first job, and like, oh my gosh, like what is going on? And there was nobody on YouTube, there was nobody on social media to say, hey, this is actually what's happening. This is something that always happens. I was thinking, what's wrong with me? Why can't I get a job? Why can't I get in? And it wasn't until I went back to the school, because my mom told me, go back to the school, see if they can help you. The guy says, I have a friend with a temp agency. And I said the same thing everybody else tells me, because I get 100 messages afterward. I don't want to work at a temp agency. I want a real job. Well, I wanted that too. I wanted that too. And then when I said, you know what? I have nothing to lose. So I went there, took their assessment test, passed it, and they said, okay, give us a week and we'll find you a job. I didn't believe him, because I was just like, already, this is a lot. It's 2 months. I've been trying to find a job. I can't get a job. And sure enough, they found me a job. They said it's a 3-month assignment. It's something to get you started, get you exposure. It was at the Cancer Therapy Research Center. Okay, cool. Coding their backlog. And that job led to me to my next job, which was at a hospital, coding for inpatient professional service. And that is how I got going, is by doing that. By going a path that I didn't think that I wanted to go down. And it's the same thing for you all that are like getting so frustrated that you're out here posting things all over social media and making yourself look bad, as far as like crying and going on that you can't find a job. There's a lot of people that are struggling to find jobs, but we need to look at what it is that we can do to improve our odds, improve your resume, get out there and actively apply. And not just apply for only, oh, I've applied for 50 positions. There's some times when you have to apply for a couple hundred positions. And then you have to be out there. You follow up only once if you've been given an interview. You don't keep hounding the people, okay? You could send them one email, and where it's very brief and to the point, where you thank them. You follow up with something that you enjoyed about meeting them, and that you look forward to hearing from them. And then that's it. You don't keep going back and forth to them. You don't post things about, oh, me and my kids are going to get kicked out of our house, and, you know, because we're going to get evicted. Don't do that. I've seen 2 like that in the last week. Don't do that. Oh, because I can't find a job in coding and this is my dream. If it's your dream, then you're going to look at what you can do to improve your odds, guys. Improve your odds and widen the search. Get registered with a temp agency for medical professionals in your area. All you have to do is hit Google. There is no national branch of temp agency that does that. It's different in every area. So what you do is you go to Google and you type in temporary agencies for medical professionals, not medical coders, for medical professional. Because again, medical coders are called different names. So you need to be as general as possible. Temporary agencies for medical professionals, and then they'll pop up the ones that are specifically geared towards medical professionals. And that is how you can get yourself registered with them, and you can get your foot in the door, because there will be temp agencies that will get contracts for coding, and they're going to need people, and that's how you can get in. I know you want benefits. I know you want all that good stuff, but sometimes that's where we need to start. And that's how we get our foot in the door. We do not get our foot in the door by loudly proclaiming we want an entry-level position, by loudly proclaiming, oh, we're going to get thrown out of our house if we don't get a job. Do you think that people are going to rush to your aid and try to help you? Unfortunately, no, because there's so many people that use this tactic. For some people, it is the truth, and for others, they're using it to manipulate others. Okay, I'm not saying that you're doing that, but what I am saying is that we have all seen this happen where people do that, okay? Don't get taken advantage of by these people that are out there trying to sell you something. If you are applying for a job and they say, well, you need to go to Fiverr to get your resume updated, that's a automatic red flag, because an employer would never tell you that. A true legitimate employer will take your resume as it is and, you know, either interview you or not. But if you know your resume is not up to snuff, and you know it's not, if you're really looking at it, if you know if it's not up to snuff, you go through and you look at my videos for resume tips for medical coders. You can Google it if you don't want to go through all my videos, but the videos are there. And so you take my tips and you apply them to your resume, and you get it down to that one page, and you get concise with what you've got on there. Don't go back more than 10 or 15 years in your work history. And you put down the jobs that you've had, regardless of whether you think that they are relevant or not. You need to think of it about how they are relevant to this field. Okay? Were you keeping things private? Were you having to stay organized? That's when you're talking about that. I don't want to see organized on your skills list, team player, smiling face on your skills list. That's just ridiculous. It's a waste of space on the skills list. Okay? I'm just saying. So with that said, and the other thing, if you say that you're a medical biller, or that you've got training in billing and that's your skill, billing, revenue cycle, and Medicare, Medicaid skill, guys, come on. You said you know medical billing. You're fine. Medicare, Medicaid, knowing that kind of stuff, that tends to go along with you understand about billing and things like that. So yes, while you understand specifically Medicare, Medicaid, that needs to be in your job description if that's what you did, but that does not need to be on your skills list. Your skills list, if you have billing, you say billing. You don't need to repeat yourself and say revenue cycle. Medicare parts A, B, C, and D. Those are three, really? You only need to list that once, medical billing, okay? I'm just saying. So with that said, I'm going to go ahead and wrap this one up. But, guys, I tell you because I care about you. I don't have to know you to care about you. I don't have to know you to care about you. I want you to get a job just as much as you want to get a job. But what I don't believe in is standing around out here complaining, because no one's going to listen to you if you're out here complaining. You need to get in there. If you really want to do this as your dream job, well, then you need to get out there and make sure that you are prepared. Make sure that you have a nice headshot, and you can do a headshot with your phone. You just back up to a blank wall and you smile and you look right at the camera, and that's it. Okay? It doesn't need to be all with a filter and little reindeer ears and a red nose. Don't do that. It's not cute, and you're not 17 to be doing stuff like that. I'm just saying. So with that said, best of luck to you guys out there. I tell you because I care. Okay? And if it's not for you, my little spicy way of telling you, well, there's other places out there that they have their own advices. I'm just saying. So with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all next time.